Good morning. Today is the 1st of November and it's the beginning of Men's Health Month. So today we're going to be focusing on men and in particular focusing on men's mental health. Thank you, Dr. Coker. It's a pleasure to have you with us.
Thank you.
Thank you. Good morning.
Dr. Sodipo, if we can kick off with you. As a general physician, can you tell us why are we having a whole month dedicated to awareness about men's health?
Yes, thank you. Well, the truth of the matter is the reason why there's a lot of focus on men's health is the first point being that men have a poor health-seeking behavior. And what has been observed from a lot of international literature and even local literature is that men are actually play a critical role in the society. And once you have the man having certain health challenges, be it physical health challenges, be it mental health challenges, it could affect the whole family. So there's been a lot of focus on how do you get men to really take a lot of cognizance of their own health. Secondly, a lot of men are role models for other people in society. You only need to look at, some of the health-seeking behaviors or some of the promotions that are being done by men in terms of those that are artists, those that are influencers in society. And a lot of their behavior is actually copied by a lot of people in the society, especially youths. So there's been an increased focus that we need to draw attention to men's health. And we've also seen that, unfortunately, in the past, a lot of focus has been on communicable diseases, our malarias, our HIV. Again, a lot of them driven, once you remove children and the elderly, you have a lot of affectation of men. But we've seen an increase in non-communicable diseases, especially those that have to do with diabetes, hypertension, the cancers are coming up now. And a lot of them are actually lifestyle driven. And they've seen that a lot of men actually have poor lifestyle, and that comes to the physical health. And then when you talk about mental health, it becomes worse. I mean, Professor Coker is going to be doing a lot of talking on that. And what you see is that a lot of men have things like depression, have things like anxiety, have a lot of mental health challenges, but they don't come out to speak about it. They feel that.
And other cardiac-related issues. It's just very a lot. Yes, can you tell us about, the real issues here for men in terms of mental health? What is it that we need to know about it?
Thank you very much. Men actually see themselves as an endangered species because of the high prevalence rates of the physical and mental health disorders. Men don't like talking about their physical health, not to talk about their mental health. When men experience various types of mental disorders, they deny it initially. And if they are to talk about it, they look for various means of trying to address the mental health challenges, apart from seeing the psychologist or psychiatrist. And I must say that the prevalence of mental disorders amongst men, of course, and women, they are on the increase. And the commonest ones amongst men, anxiety disorders. They become irritable, excessive worry, short-tempered, angry. And of course, the most common after anxiety disorders is depression. Depression initially manifests with physical symptoms, body aches, back aches, chest constriction, hotness of the body. And initially, they will think they have malaria fever or typhoid fever. So they keep on going from one doctor to the another. It is when it has gotten to the moderate or severe stages that you now have persistent low moods or fatigue and loss of pleasure on what hitherto will give pleasure. Also common amongst men is the post-traumatic stress disorder, which manifests through flashbacks or reliving of the traumatic situation, hyper-arousal, and avoidance. So these things are common in men, but men will refuse to accept them initially. And even when they get to accept them, because of the stigma and discrimination that are associated to mental disorders, they also avoid to go for treatment or management till it gets to a much more severe situation when they now have suicidal thoughts, ideas, suicidal attempts, and of course, some may actually die from suicide, like we had from Dr. Sodipo. So that's what's going on among men. Men have been taught to be macho. Men have been taught not to discuss about their emotional or physical trauma. When men don't have enough money in their pockets, they become sad. And when men cannot provide again for the household, and of course, that's another emotional trauma. So men undergo social trauma, physical trauma, cultural trauma, and all sorts of traumas, and they must cope. When they cannot cope with the experienced stressors in the community, that's when they develop physical conditions such as hypertension and diabetes. And of course, some will also develop mental health challenges such as depression, bipolar disorders, anxiety, and the likes.
I understand that also things like substance abuse become very common in this journey, as it were. Can you tell us about that?
Yes, when men find it difficult to cope with their stressors or the stress of life, and they develop the maladaptive way of coping, which include high-risk behaviors and the use and abuse of substances. Initially, you start with a bottle of the substance, then you go to 5 bottles and 10 bottles. Before you know it, there's increase in tolerance, and they get addicted to whatever substance they are using. So, of course, men get easily addicted to these substances because of the stressors or the stress of life that they are experiencing. And part of the criteria for mental health is ability to cope with the stress of life. And when they cannot cope, they develop maladaptive ways of coping through the use of various types of psychoactive substances. And that's why it's even common among the young men, not just even the elderly or middle-aged men. Psychoactive use and abuse are getting on the increase amongst the middle-aged men too, and of course, the elderly.
Well, I mean, life is very tough at the moment. And I mean, for everyone. Would you say there's been an increase?
Definitely. We have a depressed economy that has affected everybody, and most especially the man in the house that has to provide for the family. And most people find it difficult to travel with their vehicles because they can't afford the price of the petrol. And if you cannot cope, like I said, when people cannot cope with the stress of life, if you live in Lagos or live in Nigeria, Lagos stress, money stress, power stress, all sorts of stressors. And in the evening, you see these men going to various joints to drink away their stress. Yeah.
Or smoke it away,
those
depending on which type of joints they want to go to. So, Dr. Sodipo, do you have anything to add?
Yes, thank you. I mean, as Dr. Coker has mentioned, really, there's actually a link between some of the issues that we're seeing, like increased anxiety, people abusing substances, alcohol. We're seeing a lot of people even using things like marijuana, other types of substances, and of course, another thing that is coming up, people don't really look at it as a substance, but things like our energy drinks, just to keep themselves going. And unfortunately, what this is leading to is that in addition to leading to mental health related issues, we're also having an increase in some of the physical challenges that we're having. We're having a lot more diabetes because people are not eating healthy. People, when you're under stress, when you're anxious, just grab what you can. You're not even interested in some of the benefits of food as a whole. But more importantly, we're having things like poorly controlled blood pressure. And it's quite scary, the number of people, especially men, that we are seeing that are coming down with stroke. We know typically, men tend to have more risk factors compared to women. But of course, with the depressed economy, with a lot of anxiety, with a lot of depression, we have a hit. You have those that already have these conditions, not taking their medications, and those that don't have the conditions, are at risk of developing it. So I mean, I'm not trying to be pessimistic, but if we don't really take it seriously, I foresee us having, a very big problem on our hands, especially with men, and especially the important role that they play with society. So everything is linked, the physical problems, the mental problems, and of course the social problems that people use to try to cope with both the physical and the mental problems. Yes, it's a big right.
Thank you. Thank you very much. Thank you. Now, Prof, just going into it, a lot of issues stem around the fact that men are expected to be stoic and macho, as you had said. But increasingly, there seems to be, a lot of competition. I don't know if it's the social media or if it's just in general, but there's a lot of competition about, with men, not just as before, who my car is bigger than your car, but for some reason, sexual performance seems to be a part of it. And there seems to be a whole lot more in terms of discussion in that area. Now, is it because depression, etc., leads to a depression in that area? What is going on?
Thank you very much. It's part of the economic pressure on men. And I'm sure the prevalence of erectile dysfunction is also increasing, not just in the elderly men, in the middle-aged men, also in the young men. So if you cannot perform your sexual roles with your spouse, then it could lead to some kind of comfort in the house. And some form of sexual abuse. Of course, it could also be gender-based violence. We're going to talk about. If you cannot perform the sexual role in the house with your spouse, she might get annoyed with you of other things in the house, moving, shoving you, coercing you, depriving other things. Violence is subtle that cripples men. Violence against a person because of his gender, in this case, is a violence committed by women against men. They won't see it as a problem actually, because you deprive me of food or deprive me of sex, or you kind of abuse me physically, verbally, then it's a normal thing in marriages. But now it's on the increase because the prevalence against men in Lagos State from the Lagos Domestic and Sexual Violence Agency reported that in the last 3 or 4 years, over 1,100 men have reported that they are being abused by their spouses, by their female partners. And of course, research also showed that between 20 to 25% of gender-based violence against men occur in surveyed participants. So it's on the increase. It's also on the increase because men don't want to talk about it. It's against the culture to say, my wife has just given me a slap, or my wife didn't cook for me last night, or my wife locked me out. And you're the man, you're supposed to be in charge. But right now, the wives are in charge, partly because they are now more educated, they earn similar or much more salaries than their husbands. They are in charge of, they assist to pay the rent and school fees. So they are equally endowed like their spouses. And I keep on telling you that if you are not economically as sound as your spouse, you are likely to be abused, because you hear useless man, idiotic man, he can't even pay his rent or can't pay. So that's one of the reasons that these gender-based violence are on the increase amongst men, and men have refused to talk about it because of the discrimination and then again the stigma to talk in the open that my wife, whom probably I took from the village, whom probably I sent to the university to educate her, and so you can't just discuss it. So that's why Men's Health Week is paramount to talk about men. I don't know where the shift came from. The women are now in charge, and the men are supposed to be quiet if you want peace in the house.
Now that's quite difficult, and particularly in a chauvinistic society like ours. Obviously, then because what we always hear about is women being abused, because women. It's very interesting you should say that, because just the other day we were talking about women, And they're talking about, oh, how women are being abused and how women are being oppressed. And now here we hear it from the other side. And they think men are being abused and men are being oppressed. Which way is it? I mean, at the end of the day, no one should be abused and no one should be oppressed. But what would you recommend? How would you recommend men deal with this?
Well, we need to talk more, like we are discussing in the air now. We need to let our fellow men know that other men are actually suffering in their various homes, but they're not talking about. For example, the signs when a man refuses to go home early, he wants to go home when madam is asleep. So he sneaks in, eats his food, and then he sneaks out again before madams wake up. So when you see men refusing to go home early, then also there could be isolation. The spouse, the woman may prevent the man from going to interact with other men. I've seen that a lot amongst my colleagues when madam says, we are not going out this Saturday, and so be it. We are not going to that place, and so be it. So we need to talk more. We need to have what we call the primary prevention, like we're talking now, advocacy against mental abuse. We need to have a way of screening and intervening early for those that might have suffered this kind of abuse. And also, and luckily, what the Lagos State Domestic Sexual Rights Fund, they have quick intervention. If you go and report to them, they call the spouses to meeting, they provide care, they provide shelter, they even provide treatment. They have counseling sessions for those that have come to report to them. So we're getting grounds if men can come out and talk more. If you can't even go to the government.
But you know that is very difficult. As you're saying, a man should come out and say, it's difficult. I mean, so at the end of the day, how can we, we're talking about it now, but that some people are hearing, but they're saying, I can never let anybody know what's going on. I have to keep on pretending.
Yes, when they pretend, they bottle up those emotions, and then you have them developing physical health disorders like hypertension and diabetes from abuse from the family, from the spouse. And if they don't develop the physical health challenges, they may have depression, anxiety, and that's what we talked earlier about, having suicidal ideas and dying by suicide. If you don't talk about it, women can go to the church and pray about it. Women will go to the counselors, women will go to the pastors. Women have the way of letting out their own bottled up emotions. But unfortunately, globally, men have been taught that no, you are supposed to be strong physically and mentally. You are not even supposed to cry. So it's difficult. But however, we'll get there when we keep on having this public education advocacy about men's gender-based violence against men.
Now, how about sexual violence against men? Because we talk a lot about sexual violence against women, but we don't talk about it against men.
Yes, it's difficult against men to abuse men sexually. You can deprive men from having sex.
I'm talking about men on men.
Okay, men on men. Well, that's not too common in this environment.
Okay.
Sexual abuse, men on men. It's not.
Yeah, Prof.
I think
another thing that is coming up. I mean, as Prof has mentioned, we don't really see so much of men being abused or men reporting that they're abused because we're in a society where even coming out, it's against the law for a man to have any form of sexual relations with another man. So that puts men that are actually practicing, men having sex with men, being at risk because the person that is abusing them knows they're not just going to walk into a police station and make a complaint. I mean, they probably first arrest the person making the complaint, especially if the person is an adult. They say, oh, so you are even in a relationship with another man. And there was an interesting data that I guess is going to come out soon. I don't want to mention the state. So, there's some data that we collected from one of the northern states. And what we saw for example, in Lagos, most of the people that are sexually assaulted are women or female. And you have about, 98, 99%. But interestingly, from the data that is coming out from that state where they actually presented to a sexual assault referral center, we're seeing about 45% of those abused being male, and of course, young boys and things like that. So it's something that I think because of, as Prof has mentioned, all the social factors, it's unlikely for a man to want to come out and say, oh, I've been abused by another man. Or even sometimes now we're seeing some cases, though not too common, where even a woman could abuse a man. But, how do you even report such a case? And that abuse may include things like grabbing somebody, touching somebody in inappropriate manners, because of the kind of society we have, people would even ask the man, how can you say you're abused when, it's something you should even be happy about that. Some interest in you actually have a problem, like claiming that, maybe you have some inherent problems. That's why you think, you're being abused. So it's something that I think we need to look at. And, just to end, we see some of these stories, in the newspapers, in the media, where you have young boys and they say, okay, I have a sugar mommy, I have this, I have that. You tend to just look at it as, okay, somebody's doing it for money. But if you look at crimes where they take this thing seriously, and Lagos State is actually taking it seriously, having sexual relations with even a young male that is less than 18, and you have an older female, is actually a crime, in itself. Of course, the person is less likely to report it, so we don't really have the right data. But I think if we look at it nationally, some men, some boys being abused, but really nobody's going to come out and make it out to be an issue because of all that Prof has mentioned, all the risks, all the insults, all the stigmatization that's going to take place to that person.
Now, this is something that obviously, we're just opening almost like opening Pandora's box and starting to talk about it, and a lot of more discussion needs to take place. And there needs to be protection for the men in this sort of situation. Do we have any phone numbers, perhaps, of, I know, unfortunately, time is almost up, but do we have any phone numbers that men could call? Just to bring it out, those sexual abuse hotlines from Lagos State that we can share with them?
Okay, well, what I just tend to advise people is they should just ask for, as Prof has mentioned, Domestic and Sexual Violence Agency. Once they go online, because sometimes the numbers change, they can get them, and then also they could also get them through their Instagram accounts and tweets. And once they send the direct message to them, they always respond and they will always reach out, even if it's an anonymous tip. Yes.
Thank you very much. So we only have, 1 or 2 minutes left. Do you have any last words for our listeners, Dr. Sodipo?
Well, I think as men, we need to look at our physical and mental health. I think we need to take it more serious. The whole macho, you can take everything, needs to come down so that people don't die early and people don't develop a lot of mental health issues. And when we have problems, let's just talk to people, seek help. And I'm sure things will definitely work out for men going forward. Yes.
Thank you. Professor Coker.
Yes, it is paramount that men should acquire emotional intelligence and resilience skills. They must also learn stress management coping skills in order to cope with the stress of life they're experiencing, not only at home, at work, so that they'll be able to prevent the development of any physical and mental issues, especially the one associated with the home front. And that's how men can also able to ward off or prevent mental health issues associated with the gender-based violence against men.
Thank you for watching. Please like, share and subscribe for new video updates.